Good morning, good afternoon, and good evening. We are very glad to welcome everyone. People who registered from Australia, Denmark, France, Indonesia, Malaysia, Myanmar, Nepal, New Zealand, Netherlands, the Philippines, Germany, Timor-Leste, Sweden, Singapore, India, and the USA. Welcome and thank you for joining us in today's webinar. Welcome to Critical Crossroads, Health, Social and Economic Approaches to the Pandemic. We have a distinguished panel of members of Parliament from parties uh, from Asia, Pacific, and Europe joining us today. Dr. Kelvin Lee Wen from the Democratic Action Party, Malaysia. Um, our friend Martin Manurung, he is from SocDem Party, Indonesia. I'm happy to welcome Priyanka Radhakrishnan, the Member of Parliament from New Zealand Labour Party. We are pleased to welcome Emilia Toira from the Social Democratic Party of Sweden. And pleased to welcome also Kasper Sandkjær from the Social Democratic Party of Denmark. For our first round, I would like to ask our speakers for introductory statement on what are the top 3 things or approaches or policy that is now in your country that you think is best or worst in coping in this pandemic.
Thank you so much, Marcus. Thank you for having me. Thank you for allowing me to share some of my thoughts as well as some success story and maybe even some issues that we deal with Malaysia. But I think before I head on to that, please alert me if I go over time because there's so much I love to talk about this issue. It's something that's close to my heart. But before I hit into the specifics of how Malaysia is, I want to give you a macro level comparison between ASEAN, especially with other parts of the country. Why I like to look at comparison is because I believe that different countries need to benchmark each other and also to learn from one another, because the way forward is always a collaboration between the different regions. Another example I can give in ASEAN is Singapore actually has the highest number of cases in ASEAN with I think currently about 35 to 36,000, which is about 3,000 cases per million. So again, it does not reflect or shows that Singapore is handling it badly. It just shows that they are testing more, their healthcare system is a bit more resilient, and they're aggressively looking for ways to prevent the infection from spreading. So again, numbers can be a useful gauge, but we must also look at other factors behind the numbers, such as I said, resilience of the healthcare system, strength of the contact tracing, and other public health efforts as well. So in comparison, I would see Malaysia has done fairly well in comparison to a lot of other countries, as we have seen the curve flatten, especially in these past few weeks. But how did we achieve this? So I think the country has took some strategic measures that was applied by the Malaysian authorities against this COVID-19 itself. I think one of the most drastic or restrictive measure that was applied by the Malaysian government, of course, what in Malaysia we call is the movement control order. So this was actually introduced due to the exponential increase of cases in Malaysia in the month of March. Of course, it was then further extended from the 18th of March. Further extended to the 14th of April and until the 28th of April. Right now, we are also still part of the MCO. It's a different phase. We call it the recovery MCO, where the less restrictions actually imposed, more economic sectors are allowed to be open. The second step that the government took was what we call the EMCO, which is the enhanced MCO. It's basically a step-up action in comparison to the first MCO as explained. It is basically designating a certain area as red zone, as an emergency zone, where the residents of that certain area are not allowed to leave their homes at all times. All businesses in that areas are closed, no entry for outsiders, food will only be sent into the people by the welfare department. And then normally this EMCO is declared if and only if there is a sudden surge of cases in that period of time. And normally they'll announce the duration of EMCO for 2 weeks. And after that, then they will consider what will happen after that. Of course, number 3 was the epidemic prevention for immigration. One of the first things that we do was to put a movement control immigrations. All citizens were prohibited from leaving the countries. Foreigners also prohibited from entering the countries. The fourth important thing that the government did to control this was actually the mass testing strategies and isolation. So as of now, we are about 20. Our daily testing capacity is about 12,000. We have 43 working laboratories all over the country. 48 testing facilities nationwide. And the Ministry of Health are looking at adding a few more, especially in partnership with the private sector and the universities. The fifth most important thing that we had to do was public participation. So issues of social distancing, precautions, even a private sector partnership with the development of technologies, apps, tracking apps. Of course, it again opens a whole conversation of whether the big brother is watching. But different issues such as that was implemented, especially to do tracking. So like students from overseas coming back to Malaysia, especially for example to my state, each of them were given a tag where they have to wear it, and then they will be tagged and they have to report themselves at a certain time of the day to make sure they do not go against their home quarantine order. So all the good steps that's taken by the Ministry of Health, all these are important, but the other arm that has to be done is of course the public participation and their buy-in. Thank you, Chris.
Thank you, Kelvin. Thank you. That's movement control. There's mass testing, targeted testing, and public participation. We'll go to New Zealand now. A star in the global community to this approach to the pandemic. Priyanka, how did you do it?
Firstly, can I just say thank you for having me on as a panelist this evening. It's great to have the opportunity, and just good evening, because it's about 8:20 in the evening here in New Zealand, to you all. And as we say in Te Reo Māori, which is our native language in New Zealand, kia ora koutou. I might just begin by just acknowledging that the last few months has been incredibly tough for many. Those who've lost their jobs, those who've lost loved ones and friends over the lockdown period, as we've had here in New Zealand, and also for many, including our migrant workers and those who may be in a similar situation around the globe, I understand, facing quite uncertain futures as well. So just wanted to acknowledge that as a starting point. I thought I might adopt a similar approach to Kelvin's in terms of laying out perhaps the underlying principle that's based our government's approach to responding to the COVID-19 pandemic. And that's largely been to go hard and go early. So to make some really tough calls and to do that quite early in the piece. And of course, in New Zealand, we've had a little bit of an advantage of time and distance, because we've been able to sort of see how the pandemic has unfolded in various parts of the world before it reached our shores. We knew it was just a matter of time before New Zealand got our first case, and that was in March. So we took some unprecedented measures, closed our borders, something that's never happened in New Zealand's history. We did that on the 20th of March, and the border was closed to everyone who was not a permanent resident or a citizen. There was an exception put in place, a travel ban exception, which was very strict for a small number of people who had a critical need to travel to New Zealand, and largely that was on humanitarian grounds where families were split apart. But again, the criteria around that was incredibly strict. So prior to the border restrictions being put in place, we had up to 20,000 people arriving in New Zealand each day. And even without tourists and temporary visa holders entering New Zealand, we still had to manage the risk of returning New Zealanders and their families as well. So we've had quarantine and self-isolation measures measures in place from April, where everyone who crosses the border needs to either self-isolate in a managed self-isolation facility if they're asymptomatic, or a quarantine facility with sort of stricter health checks and so on and so forth if they do have symptoms. So the border closure was a key element of our health response. And also the go hard, go early underlying principle was from the viewpoint that if we, a strong health response was the best economic response as well, because without protecting the lives of your people, you have no economy. And that was largely our government's view when it came to the measures that we had to take. The second pillar, I guess, to the health response was a complete lockdown. So we've got an alert level system that the government put in place very quickly, and it goes from alert level 1, which is where we're currently today. And I think at this point, I'll just mention that this is our 19th day where we've had no new cases and no active cases either. So that's alert level 1, where virtually there are no restrictions anymore as of the last couple of days. And the only restriction that remains in place is the border, which remains closed because, international travel still poses the biggest risk to us, to the spread of COVID domestically. So alert levels sort of go up from 1 to 4. Alert level 4 is the strictest or the strongest lockdown, as it were. And we were in alert level 4 for about 33 days. From the 26th of March to the 27th of April. And that is basically where everybody was asked to stay at home unless they worked in an essential service. So just over a month in a complete lockdown. And the third component that I just wanted to speak to in terms of the health response was the testing and contact tracing aspect of it. So we had to ramp up our testing capacities quite considerably. And I think to date, we've had close to 300,000 tests, because our strategy was an elimination strategy, which was basically to detect clusters quickly, to then ensure that everyone who needed to be tested, the message was basically, if you have a sniffle, get tested. So it was regional testing. We had mobile testing stations that were out and about, and we made it as easy as possible for people to get tested. And then contact tracing, so every single person that was tested positive was contact traced. And then, of course, health services, medical services to those who needed it. So to date, we've had 1,154 cases in total. 1,132 of those have recovered, and we've had 22 deaths in the last 2.5 or so months. Yeah, so I think I will leave it there in terms of a health response, but that's largely the pillars of our health response. And we were very clear that without a strong health response, basically we would lose lives and our economy would tank.
Thank you, Priyanka, for sharing us the elimination strategy in New Zealand, and congratulations for not having cases for a long time now. And it was announced that the normalization is coming forth. But the pandemic is not yet ending and anytime soon. And I will go to Sweden. And one thing about the Swedish approach is that it created a global discussion on how do we balance movement control and the health approaches. And we'd like to hear from Emilia. What's your take on this? How's this?
Thank you so much, Magdis. Sweden has been highlighted a lot in the international debate ongoing. And first, the things we've done in Sweden doesn't differ that much from the rest of the world. The main difference is that we've used recommendations instead of strict laws. So we haven't had the policemen out policing when people have been moving in big groups and so. they have, last week we actually had a demonstration on Black Lives Matter, which gathered around 3,000 persons in a very small area, and the police made them leave because it's not allowed to be more than 50 people in one place at this time. But we haven't had the kids, they have been outside playing basketball still, soccer and so on. But we were asked to have the top three in what the government has done, and so I'll just start with that, and then I will also finish with that as a reminder, so to say. So the first thing that the government has done that has been efficient is to make sure that the healthcare sector has had enough resources, and this has really been it's been a challenge because the last 20 years we've had a lot of decrease in how it's been financed. The second part is we've had different approaches to the social insurance system, so that people actually stay home if they have symptoms, even though they don't feel sick, to make sure that everyone takes this seriously and that they don't have an that they won't be affected economically. A bit it has been still, but to make sure that from day one you will still have money even though you don't go to work, and this has proven to be efficient when it comes to avoidance of the infection, and also in order to make sure that the companies and businesses aren't too much affected. We've released something that our party leader Stefan Löfven, as a former union leader, thinks is really, really important to have a short time work, we call it. So it means that you can still have, you will still have your income even though you don't work as much as you used to. And also, as well as in other countries, people work from home. So what you see here is is my home office. The numbers in Sweden are quite high when it comes to the mortality rate. So we have, let's see, it's actually 4,717 people that has died out of COVID-19. And that is, of course, not acceptable in a country where we have 10 million people. It's really high. We also have a lot of infected. But if you see, one thing that we can see is that when it comes to Stockholm, the capital city, this is relevant for Stockholm because it's much higher than the country as a whole. If you compare the rest of the country with other countries, you will see that it's not, you can't see a big difference, none at all actually. And this comes with social injustice. This pandemic has actually pinpointed out that we have much to do when it comes to injustice and inequality in Sweden. We tend to say that we are one of the most equal countries in the world, and that may be, but not in the whole of the country. And it's really a long way to go. So that is what we can see has been most, well, the biggest effect, and maybe, well, not the reason, but one of the reasons that the mortality rate is so high. It hasn't been that many people that has been tested because in the early on, when that we were aware of the crisis, a lot of the resources had to go to intensive care. So we knew that we didn't have enough resources when it comes to personnel within healthcare. So we had to prioritize, and therefore it wasn't tested as much as we should have needed to. but that has it has been I don't know how many billion Swedish kroners that has been put into mass testing now to make sure that we receive this immunity within the population. But the government's main priorities in the crisis is to lower the spread of the virus, of the infection, to make sure that the health and that the healthcare has the right resources when it comes to financing. But still, we have a lack of personnel, and this is not something that can be easily resolved. The third priority is to decrease the effects on what we call things that are important for the society. So to make sure that the police are still strong, the military the same, as well as I mentioned before, the healthcare sector, and all those different people that might be extra important in this time, and also others, and also to decrease the consequences for citizens and companies. So a lot of resources has gone into businesses to make sure that they don't have to shut down, and also to make sure that we don't know what will happen, and we didn't know that from the start either. So it's important to put in the right measures at the right time, and that is also ongoing. So there is no prestige in going back and doing things differently, or to open up the society if all the experts are united in that side. So that is the conclusion of the Swedish government's work.
I liked it when you said that we are mitigating effects and consequences. Your resilient health sector and with your healthcare system. We will turn in now to Denmark.
Thank you, Marcus, and thank you so much also to my colleagues for your presentations. It's going quite good in Denmark compared to the rest of the world, and yeah, we have had I think actually quite close contact with between the Prime Minister of Denmark and the Prime Minister of New Zealand, and we have pretty much followed the same strategy on handling the pandemic. And when Denmark first when we first saw the virus in Denmark, we had a strategy on testing everyone who had symptoms and tracing who they have had contact with, and getting them tested, and try to keep it under control. And we could quickly see that the virus was out of our control. So it was spreading too fast in the society. We couldn't keep track of how the virus was spreading. So quite early we made a quite comprehensive lockdown of the society. So all schools, universities, higher education was closed. All public employees was sent home, working from home. Also a ban against assemblies, but with more than 10 people, which I actually think has been one of the most effective tools we have used. And we can see now from research that it is the large assemblies where someone is ill that the virus really can spread quickly. So I think the ban on assemblies has been one of the most effective things we have done. So we made a comprehensive lockdown, and that has worked. So we are closing on having the pandemic out of Denmark. It's now in a stage where we have it under control, and that is why actually we we are quite open again. The society is quite open again. Have also now started opening the borders. We were one of the countries who locked down the fastest, and now we're also one of the countries that can open up fastest. Of course, all the restrictions has been really effective. The ban on assemblies has been really effective, but the most effective thing has been the citizens taking in new ways of having social contact. So keeping distance. First, the authorities said 2 meters. Now we're down to 1 meters of distance between people. Having everyone washing their hands all the time, using disinfection, and of course to lower the activity in the society. So, I think just one last thing we have done quite quickly after the lockdown, made up a political agreement on very quick funding to research in COVID-19 and the coronavirus. So the vaccine research is all over the world, but really we have put quite a lot of public funding in it here from the beginning to see if some of our very good health researchers and in our universities can come up with a vaccine. So yeah, a quick lockdown, money for research, closing the borders, and the citizens' very good effort on keeping distance and washing their hands has been the most effective tools here. Thank you.
Thank you for your sharing. I like it when you point out that it's the citizens' effort, a collective effort to really combat the challenges of the pandemic. I am happy that we have an MP from Indonesia, from a steering committee member of SocDem also joining us now. Welcome, Martin.
Thank you very much, Macris. Hello from Indonesia. This is now in Jakarta, 4 p.m. I would like to start my presentation about Indonesia and the COVID-19 pandemic. Okay, now we know that the current state of this pandemic is already more than health issues. So COVID-19 has huge social and economic impacts for the world. That's in Indonesia alone, more than 2 million people have lost their jobs. This is open unemployment. If we see the number of the disguised unemployment is around 45 million. So never before in history that Indonesia has had the number of unemployment as high as the current state. We also have decreased revenue for small and medium enterprises for more than 163,000 SMEs. Because the SMEs is under my supervision, so now every day this is our daily jobs on how to bridge between the SMEs and the banking systems, because now they're having credit problems, and maybe they need support for their operation. At least they can survive in this pandemic. And also in Indonesia, as end of April 2020, we also know that more than 800,000 proposals, 800,000 people have proposed their proposals for debt restructuring programs. So this is more than the 1998 crisis, what we call the monetary crisis. This is the first time in Indonesia's history. The government declared healthcare emergency through presidential decree number 11. So since that time, the government is functioning our national body of disaster management as the head of what we call the gugus tugas, the task force to deal with all the COVID-19 issues. The second one is the government gives the authority to local government, provincial and municipalities to implement social distancing policies. That in Indonesia also we have what we call pembatasan sosial berskala besar, or easily translated to social distancing policy, but literally it is translated with big scale social limitations. So people is not allowed to travel within cities, and we are not allowed to have meetings or any functions for more than 20 people inside. And also public transport is also limited. And I think markets are also closed within the red zones, what we call red zones, when we have high infection. And for the taxis, for the car, public transport, they are only allowed to have 50% of the seats capacity. The third one is the economic response, budgeting, fiscal, and monetary adjustment. So in Indonesia, it's very important to maintain the demand side in order to avoid the economy to become harder hit. The first economic stimulus program is what I mentioned earlier. The second one is the additional social safety net program through staple foods aid, unemployed incentive program, and also direct cash transfer. The third one is tax incentive program. So now in Indonesia, people are getting discount for their income tax. So subsidies for electricity bills, because we have to work from home, and it affects the electricity bills. In a nutshell, the government is trying to avoid the health crisis to become severe economic crisis. So we don't want to have a dual crisis. In that sense, health and economy must go together. I think this is already now the concern of most countries in the world. But we have problems, I think, which is different from what Casper was explaining about Denmark. In Indonesia, we have lack of obedience from the society level, from the people, to safety procedures. So if you travel in Jakarta, for example, maybe about 50% of people on the streets are using masks. So this is already a challenge to avoid the infection. Plus, we also have weak enforcement from the government. So this is actually now the problem, because the government cannot enforce it strictly. We have seen in some municipalities outside Jakarta that there are fightings from the people to the police when the police want to implement or to enforce the health procedure. The second one is we also have political competition, because in Indonesia, all government levels are elected, and many times these leaders come from different political parties. So, for example, in Jakarta, the governor of Jakarta doesn't come from the same political party as the president. So many people want to try to compete them. And I have, for SocDem party, we have criticized this. We have strongly support both the president and the governor. Also, although we didn't support the governor in the election, but I think now it is not the time to have political competition between the governor of Jakarta and the president and the central government. So from SocDem side, we want to bridge the communication. We want to have both the president and the governor to work together to fight the COVID-19 pandemic. We also have problems, I think, in slow response in the beginning phase. So when many countries in the world are anticipating the COVID-19 pandemic, Indonesia was opening their borders. Government was trying to invite more on tourism, for example. And also when many countries in the world need for the basic supplies for health, for example, the mask, hand sanitizer, and etc., we export them. So we export them massively. So when the virus came into Indonesia, I have to say we also have a health and food security problem. So as we know that Indonesia is have huge dependencies for import goods. So I think this is already an answer that market alone is not the only parameter, because now within this pandemics we learned that it's not always having the good price. So we import to have a better price, but we also have to have the capacity to produce, to have the security in the basic sectors, including food, including health, and also energy. I think some of the key lessons that Indonesia has learned from this pandemic is, first, social safety net programs. The government has had many programs for this regard, but I think apart from like social support and also direct cash transfers, we have to create jobs, because now we cannot depend on the industries, we cannot depend on the business because they also have problems. So the government must create jobs. How to create jobs? We have now a lot of public works, we have now a lot of social work, that actually the people who are now unemployed can do the public works and social works and they get salary. And we have already have talks with the government about this, and I hope within this June or July, public works and social works can be implemented, and it will involve the people who are now unemployed and they get salary. The second lesson, I think I have mentioned earlier, that market is not enough. So now the government now is trying to produce the supplies, the health supplies, and we have already report from the president that Indonesia is already successful in making their own masks. And the third one, the lesson that we get from this pandemic is, when democracy and government effectiveness is in crisis, now we have to revisit again whether our system of democracy, in a way, because we have now, I think, one of the most liberal democracies in the world, must be implemented in the same way. Because if we see the competitiveness between the level of governments and also between the political parties, I think it is not effective for the government to have more control of the pandemics. And also, of course, we need the people trust. This is the thing that we need to study more.
Thank you for noting that the key lessons on health and economic approaches that Indonesian government is doing now. I like it when you said that there are measures that we could have done before, but we have not done it. That's why we are facing the crisis today. We have so many things to experiment on doing just now, but could have been avoided if we tackled issues of food, as you said, issues of health, as you said, and also the issue of trust in society, as you said. Of course, there are numerous challenges. No? And you have already said that this is a nexus of health and economic battle. But how do we avoid in the future these types of pandemic wherein we are racing in time to not have people suffer further? What could be in place as policymakers to mitigate and to really avoid the recurrence of of such pandemic?
I think something that has been quite clear during this crisis is that different countries handle the crisis in different ways, and I think it's too early on to say that someone is doing it more or less right. But something that has been clear to me, at least, is that inclusion of citizens within combating the pandemic is crucial. So in order to actually have sort of a mass vaccine before we have a vaccine, is that everyone understands what they should do and why they should do it, and also to actually have the possibilities to do it. So if you are ordered to stay home and not go to work, how do you provide for your family? I think it's impossible to put people in strict quarantine if you don't have the means to do it.
Yeah, thank you. I think as decision makers and as government, when we are in this type of crisis, I think we have two important tasks that we need to balance. One is to protect the life of the citizens. So when we closed down a lot of Denmark, we did it so people wouldn't die, and that has worked. So that is the one task, and the other task is, of course, to protect what kind of life the citizens that are alive can live.
And it's very similar for us in New Zealand as well. I'm just going to pick up on something that the way that Amelia put it, which was basically that everyone knows what they're expected to do, why they're being asked to do that, and they have the means to be able to do it. And I think that really hits the nail on the head. And for us, you know, reflecting on the approach that the New Zealand government took. It was a science-based approach. It was an evidence-based approach. We are, you know, Prime Minister and our cabinet were very much in tune with what the medical health experts were telling us needed to happen. And I think that's really important when it comes to a health crisis. I didn't touch upon it earlier because I thought we were going to specifically go to a socioeconomic bit of this, but I thought I'll just throw it in there as well, because part of having the means to be able to do what the government expects you to do, which in our case was about a month and a half of a pretty strict lockdown effort, is to be able to do that. So part of the government's response was to ensure that people had the income that they needed. So that was increasing, we're a welfare state, that's increasing benefits that the people, you know, those who are most vulnerable had. And our wage subsidy scheme was really designed to keep people connected to work, and also the certainty and the dignity that often comes with work as well. Also a funding boost to the NGOs. So the community and voluntary sector played a huge role in ensuring that people, you know, addressing homelessness, ensuring that people had the support they needed for accommodation, for food, and access to other necessities of life as well. So ensuring that the government could increase funding to those organizations that were helping people on the front lines as well. In terms of ensuring that people know what they're being asked to do is, of course, clear communication. So the alert level system that I mentioned previously that the government put in place had a fair bit of detail in it, so that people knew, our citizens knew, when we go to specific alert levels, what they would be asked to do. And our Prime Minister has been phenomenal in terms of communicating that message, along with our Director General of Health. But, you know, she'd often jump on a Facebook Live and actually explain what decisions Cabinet was taking and why, so that as a government, we focus on people, but we also take them with us to ensure that they're aware of why we're doing certain things. And that builds to my last point, which is trust in your government, trust in the system, the political system that you have. And to that end, one of the other one of the other measures I guess the government did or took was to ensure that everyone's able to access that information during the pandemic, and that includes our diverse ethnic communities. We have people from over 216 ethnicities in New Zealand who collectively speak 160 different languages. And I'll end with a little whakatauki, we call it in the Indigenous language, which is just a little phrase really. And it goes like this. It says, he aha te mea nui o te au, he tangata, he tangata, he tangata. Translated, it means what's the most important thing in the world? It's the people, it's the people, it's the people.
Thank you, Priyanka. That's very well. It's the people, it's the people, it's the people. It's getting people with us, deciding for themselves, getting the people behind our policies to make it stronger, and getting people to be informed as much as we can, as far as we can, on in avoiding these things, and the effects, and how we turn these things around in the future.
So for me, this whole pandemic itself is a stress test for not just the healthcare system in the different countries around the world, but also our economic system and also our social protection system. I think on the base of the healthcare system, I think one ways that we have to move forward as we prepare for future pandemics, because trust me, SARS-CoV or COVID-19 won't be the last pandemic that we're going to face. But one of the issues that we need to learn as a whole is how it amplifies the systemic lack of, I think, in investments of public good, especially in our healthcare system. And this is true in many countries, especially in Asia. So that is why I think moving forward, it's very imperative that the governments look into increasing national healthcare spending, not just to deal with the current pandemic, but also other pandemics that is to come, as well as what we are facing in a lot of Asian countries is what we call the silver tsunami, or the aging population. I think on top of that, the government should provide more incentives actually to promote local production and also of essential materials, PPE, masks, hand sanitizers, to reduce our import dependency on such essential items.
Okay, thank you. First, I think, like I said earlier, we learned from this pandemic is Indonesia actually doesn't have any strong foundations in any sectors. So the three sectors that is the most important sectors, I think, regarding this this pandemic and its impacts is first the health sector, and also the food sector, and lastly the energy sector. In these three sectors, Indonesia is highly dependent upon imports or maybe international trade. So I think the first lesson for Indonesia's case is to have to realize that economic alone is not enough. We really have to have our own foundation, so that whatever happen in the future, Indonesia doesn't have the, to be shaken a lot. The second one, regarding the health and social response, I think I agree with all our comrades said earlier, that we need to reform again and make sure that most of the population is covered by our health insurance. So I think this is the ongoing project Indonesia has started to develop our health insurance program for, I think it's about 4 years now, and we need to work a lot of this to make sure that it is ongoing and it is in the right path. We have to make sure that stability is also important, because we don't have to, when we are facing health crisis and maybe possible economic crisis, we don't want to have political crisis. So I think this is what also we have to work in the near future. But I would like also to add, as a network, I think we also have some important things to do for us as the social democrats. First, we need to campaign more that international cooperation cannot always about the economy. So cooperation between countries within this pandemic has shown that we have to also put our bold mark that between countries we also have to cooperate for social cooperation, for health cooperation, and maybe promote more about dialogues and experience exchanges between countries, so that having this time of crisis, we have to campaign that we cannot face this alone.
Thank you, Martin. Thank you for your take on the political dimension of the crisis. Of course, there is polarization created by this. We see the inadequacies of the system, and of course, a global solution has to be built in responding to crises like this. And this is the time where unifying solutions, not divisive solutions, will have to be put forward. This discussion, this webinar is very enriching in our analysis and in our finding solutions, and the perspective, the experience, and the determination of our panelists are really seen on how they view our challenges to this pandemic, and the solutions that they are recommending, and the solutions that they are finding. My takeaway is that this pandemic is multidimensional. This is not only a health challenge, this is not only an economic challenge, but clearly this is a political one. Clearly, this is a social one as well. And our policies have to be quick, have to be progressive and far-reaching to approach this crisis, that no one should be left behind, that our solutions should put together a solution that will make our society better out of this. Indeed, this is a global challenge. Our pandemic needs a global solution that is not approached only by one country, not only by a developed country, but a solution that entails more solidarity, more democracy, and more justice. Everyone, thank you. Stay well and stay strong. And we will see you in the next webinar, and hopefully face-to-face in the future. Mabuhay from the Philippines. Thank you very much.